Hello friends, I am Dr. Mohit Agarwal, Director Medical Oncology, Fortis Hospital, Shalimar Bagh, Delhi, India. Head and neck cancer is the sixth most common cancer worldwide, but it is much more prevalent in the countries where tobacco is chewed. And we are aware that India, the tobacco chewing is very common, and hence we are a hub or the capital of head and neck cancers, including cancers of the oral cavity. Now, why these cancers are important and different from others is that you have very important pathways, which are your oral pathway for eating, as well as your respiratory pathway, as well as your speech, which are involved and affected when these tumors are there. And a lot of the impact is not only to the individuals who are affected by this disease, but also it affects the functioning of the family members, and thus it has an impact on the entire society. So a lot of new developments and strides have been made in the past decade, and so where much more compatible forms of therapies have come to improve the aesthetics of the patient as well as to retain the functionality, which would involve minimal invasive surgeries and surgeries which would be basically looking after maintenance of the functionality of the patient. In terms of the radiation protocols, there has been a rapid transition from low voltage X-rays to super voltage linear accelerators, and then to electrons and proton based treatment. We have moved on from conventional radiation regimens to IMRTs and now to image guided approaches, where the approach is much more targeted, minimizing the damage to the adjoining area and having the maximal benefits. In terms of the medical management, the outcomes and treatments have also changed remarkably. We started with something like a nitrogen mustard in World War II, subsequently going on to bleomycin, methotrexate, platinums, then TKIs, and now we have drugs which are known as targeted and immunotherapies, which have now come out to be very patient friendly and with improved outcomes for the patient. Also, the drug administration focus has changed from something like a palliative to like an induction therapy, and then to a concurrent based regimens which are given along with radiation. This, along with immunotherapy and targeted therapies, can be given for a long duration of time, having a sustained maximal benefit to the patient. This, along with advancements in pathology, radiology, prosthodontics, in terms of more imaging modalities, better radiation techniques, and better chemotherapies and targeted drugs, better surgical drugs, have all led to the development of modalities which would improve the patient outcomes. Also, we have now some internet-based protocols and support groups where patients do get emotional support and are really able to understand their course of treatment and the problems and obstacles which they are going to face. The biggest advancement in the past century has been the integration of different resources which I have already mentioned, and formulating them into a multidisciplinary approach and team, where all cases are discussed in the multidisciplinary team and the best course of action is decided. So I feel that we have come a long way in terms of improvement for head and neck cancer patients, and I see very exciting times in times to come, where I believe that the approaches would be much more fine, much more tailor-made, and much more in terms of improvement of the patient outcomes.